We continue the program with Sys Zoffman, Managing Director of Biomedical Design, Novo Nordisk Foundation, which specializes in user-driven and need-led innovation in healthcare. She has built programs that bridge clinical needs with technological and entrepreneurial solutions and brings insight into how design thinking can accelerate implementation of medical innovation across Nordic systems.
Yes, thank you. So whereas Heikki talked about regulatory literacy, my job is to establish innovation literacy in Denmark to build up our innovation capacity, both among our clinicians, our researchers, and the people working in our medical device industry. And the way we are trying to do that is by taking people through a needs-driven innovation journey. As we also heard in the morning sessions, it's been mentioned a few times that innovation is teamwork, and we need interdisciplinary skills and teams to create innovation. And that is exactly what we do in the biomedical design program. So what do you see here? Four disciplinary experts. And so what? What's the connecting thing between these people? Nothing. Absolutely nothing, unless we give them the mindset and the skills to actually tap into each other's skills and knowledge and to use that to create innovation. And the biomedical design program actually bring these people together, these disciplinary experts, and through training in innovation processes, they learn and develop their soft skills to actually bring together each other's competences to make innovative solutions. And why is that important that it's interdisciplinary? Well, a lot of research says that the inventive level of the ideas that you create in an interdisciplinary team is much higher than in a monodisciplinary team. Also, you can see that in interdisciplinary research papers. They actually have a much longer shelf life than monodisciplinary research papers. So the problem is that when these people were educated, they were not taught to work in interdisciplinary teams. Maybe most likely they didn't even learn how to work in teams, which is sort of, peculiar, because in any workplace, teamwork is sort of the main thing that we do. And in innovation, teamwork and interdisciplinarity is key. So that's what we try to do. And as of today, biomedical design have trained 102 disciplinary experts to be interdisciplinary innovation fellows and experts in that. And they work today in the Danish medical device industry, in the Danish third sector, in research institutions, in hospitals, and in their own spin-outs that they have launched out of our program. And a little bit about our program. It's a fellowship program for 10 months, full-time. And since it's for already experienced professionals, we provide them with a stipend, so to sort of replace their ordinary income. It's an interdisciplinary and international program, so people from abroad also applies. And we have diversity in age, you can say, spanning from the youngest being around 29 and then running all the way up to 55. So maybe for some of you it's not too late. And then, as you can see to the right, we sort of succeed in having this interdisciplinarity. Health covers both, that it's physicians and nurses and physiotherapists, And on the other side, we have very different engineering disciplines. We have people from life science research, natural sciences of different backgrounds, and some computer science also. From the design and business, which is the sort of the smallest category of participants, we are very fond of having industrial designers in our program because they are really good kit in between the different disciplines, and they have such a strong process understanding that the other disciplines are not sort of having naturally. Yeah. It's international, so we also, are working across cultures, and that's also providing a lot of perspectives or adding a lot of different perspectives to the healthcare problems that our fellows are studying. And we try to stay as gender equal as possible. Yes. So the BMD, Biomedical Design Innovation Journey, what is it? It's needs-driven. So that means that the participants, the 16 participants we take into our program every year, they come with a clean slate. It's not starting with an idea. We collaborate with hospitals and bring them into a clinical setting where they have the opportunity to follow and to shadow the daily clinical work. From that process, they become curious about what they see, because they see a lot of sort of things that makes them wonder about why the clinicians are doing the way they are doing. So that leads to some spotting of problems that we then give them the tools to qualify and into actual unmet needs that are worth pursuing for an innovation opportunity. Only then do we begin to create what could be the solutions. And that's why we are sort of calling it a need-driven process. After the creative skills phase, where they have ideated different solutions, but also very quickly tested them out with the potential users, providers, and payers, whether it's sort of a right problem-solution fit, we move into the concept and commercial skills, where we are getting this product-market fit and building the business case and the different strategies, including also regulatory literacy. So what the field study does for our fellows, even for our clinical participants, is that it gives them opportunity to gain a lot of insights about processes that they don't normally have. Maybe they have at a macro level, but getting the insights on a micro level gives you some insights into friction points, to incentive structures, and also it gives you a context of where a potential solution in the future is going to take place. So they get to understand the people who are involved much better than if you're just innovating from knowing a need on a macro level. It also establishes relations that they lean on moving onwards with developing solutions. The Danish program is anchored at Aarhus University and Copenhagen University, so our fellows are distributed 50-50. We sort of recruit fellows from the whole country, and we also collaborate with the hospital partners in all 5 regions in Denmark. And we have in our steering committee representatives from big and large, or university hospitals and regional hospitals in all regions. And that means that throughout the last 6 years, we are now in our 7th year, we have stimulated innovation across both big and small hospitals all around in Denmark. And that's to sort of lift the innovation culture and activities all around. And as you know, that's important because as anywhere else, Denmark is also in the process of transforming our healthcare to be able to handle the double demographic pressure, the surge in multi-chronic diseases, and so forth. And we have an ambition to achieve that and still keep the high quality in healthcare that we have today. And it's foreseen that the technology is playing a key role here in supporting that transition, but we need to center the technology on the citizens' needs. And that is why we are building the capacity with our fellows to give them the agency to design the future of healthcare.
Yes, thank you so much. And